Hey team, I just wanted to make this quick video because I remember when I was starting third year rotations, and I was scared to death because no one really told me what they were like or what to do, and I was like reading all this stuff on the internet, and I felt really lost on what it was going to be like, and I did a lot of things wrong at the beginning. It was fine, and you'll be fine regardless of whether or not you like do what I say or watch this video. Like it'll be fine. But I just wanted to give some advice on kind of how to approach clinical rotations, maybe kind of talk about the shift in attitude that happens going from preclinicals to clinicals, how to be successful on your exams and step two, level two, and kind of my experience. I think this is a really kind of scary transition time. And so I just, one more bit of advice couldn't hurt anybody, right? But yeah, so to start off, just kind of, I think that the attitude that you have as a preclinical student is different from the attitude you have as a clinical student, right? When you're a preclinical student in the first 2 years, the whole building is like for you, right? Like the whole institution is revolving around you and like what you need and like your learning, right? And then you go to clinicals and you're in everybody's way all the time. Nobody really wants you there. The whole thing is happening without you, right? Medicine is happening not for your benefit, right? So when you go to a clinic or when you go to the hospital, you have to keep that in mind. You have to remember that like this is somebody's doctor's appointment, right? This is somebody's end of life scenario, right? This is somebody's surgery, and it's not about you, right? Like you're there, and it's amazing that you get to experience that part of people's lives, and it's a privilege to be involved in people's healthcare in that way. And I hear a lot of things about students behaving inappropriately on rotations. And I just think a lot of that comes from it's really easy to not make that shift in your brain immediately, right? To not realize that your learning environment is no longer designed for you, right? It has nothing to do with you. So just keep that in mind while you're rotating, right? This is not about you. And that can help you go a long way in preserving your relationship both with your patients and with your attendings. Seriously, I think that's most of having a good relationship with your attendings is just realizing your place in the whole scenario, right? And then with that, you are now an independent learner, right? Most of your attendings will not teach you the majority of what you need to know for your exams and to establish your clinical base. They'll teach you like little nuggets and little things that you'll probably remember forever, and you'll think to yourself, wow, it's so great. Like, I wish they would teach me everything. They won't, and they don't. And you are responsible for establishing the framework of your medical understanding and medical knowledge, which is tough, right? That is not easy to do and not easy to transition from because you're coming from preclinicals, right, where they give you the PowerPoints, right? They give you the material and they're like, this is a list of what we expect you to know. And then you're trying to get ready for these shelf exams and you just, like, there's no complete list of what you need to know. So it can be very overwhelming and it can be very easy to either over prepare or under prepare for the exams because you don't really know what's expected of you. I just want to talk a little bit about my strategy for preparing for shelf exams that I kind of figured out over the course of the couple of years that I was doing rotations, and kind of how you can make it work for you. But I think the biggest thing, right, is just practice questions. Practice questions from the get-go. Every day, doing practice questions. Do not wait until the last week of your rotation to prep for the exam. You can do that, and you might be fine, but you might not be fine. And failing a shelf exam is not a good experience, obviously. And so what I would do, I used UWorld. I also used an Anki deck that I found online to prep for step two. It's called the Divine Intervention Podcast deck that I found really helpful. I just opened up that whole Anki deck at the beginning of last year and did 40 new cards every day from that or whatever, which sucked. I hate Anki, but I didn't do Anking, and I made flashcards based off of the practice questions that I missed. So basically what I would do at the start of a rotation is I would look in UWorld. UWorld divides up their content based off shelf exams, right? So I would go to the UWorld block. I would see how many questions there are for that shelf exam that I have, and then I would calculate how many days I was going to do practice questions for that shelf. I would leave 3 days before the shelf exam, or I would not plan to do any new UWorld questions. Okay, so, and then I would do questions 6 days a week. I would have 1 day off from doing questions every week. So for a normal 4-month rotation, that would end up with me having 6, 12, 18, like 21 study days for the rotation. So I would take however many questions there are, divide it by 20, 21 or whatever, see about how many questions I needed to do per day, and that's how many I would do. Usually it ended up between 8 and 15, depending, but not bad. So every day I would do my flashcards, I would do those 8 practice questions, and then I would make 1, maybe 2 flashcards just for any practice questions that I got wrong. So I would look at the practice question. What is it about this question that I didn't understand? Why did I get it wrong? Make 1 flashcard about that exact point. And I would do that until the last week of the rotation. Usually like the Monday or the Tuesday would be my last day of new questions. And then the last few days I would spend doing all of my incorrects, if I could make that happen with time. And I would do usually at least 2 or 3 of the NBME practice shelf exams. So I felt like that as like a study strategy, like was a guarantee positive result on the shelf exam. And yeah, I felt really good about that. And I think that's a really good way to go about it. I think it's really manageable. You'll read a lot. People will have different resources for different rotations. And let's say the rotation that I did the worst on the shelf exam was surgery. That was my first rotation, and also the one that I spent the most time studying for, and the one that I used the most extra resources. Like I read extra books, and I did extra question banks, and I did a bunch of extra stuff. And that was by far my worst shelf exam. I just think it's easy to get overwhelmed. So I think just pick one resource that is like comprehensive in its content, like UWorld, right? And just do that. You don't need to do a bunch of extra stuff. Also, yeah, it's again difficult to figure out what it is that you need to do, what it is you need to learn, and really just if you're getting those questions right, you're doing great. There's not extra stuff. If you're not, like, just read from those, right? Like, then the other thing is on rotation, right? Reading on rotation about your patients is important. It is important to understand what is going on with your patients. So talking about the actual work of your rotation, right? Transitioning away from studying for the shelf exam. Rotations team are not hard, okay? Sometimes the hours are longer than you would like them to be, but your job as a student is not difficult, okay? Usually you will be assigned somewhere between 3 and 5 patients in a day to see, whether that's pre-rounding in the hospital and rounding with your attending, or if that's in the clinic, right? Like, it kind of just depends on where your clinician feels that you're at, right? Like, by the end of your rotation, maybe you're seeing half of their census. Like, it just kind of depends. But the important thing about that is this is a really fantastic learning opportunity, but it's important to realize that these learning opportunities don't necessarily tie to your preparation for your exam. So that's unfortunate, but it is also really important to build your medical knowledge base. So the most important thing I think you can do in preparing for like your patients is just reading their chart. Like, okay, Adam, what does that mean, right? I've never worked in a hospital. I don't know what that means. That is fair. I also did not know what that meant, really. So you should have access to the electronic medical record wherever you're rotating, ideally. If not, that kind of sucks. I never had that scenario. I don't know if anybody has that. But so when you are assigned a patient, you search their name in the EMR, whatever their number is. You find their chart, right? Them in the electronic record. You open it up. And I think the most important thing to do is find like the most recent note. There should be like a tab in the EMR, something like documentation or whatever. The goal is to find the note, like the SOAP note from whoever the last doctor was to see them. Ideally the last doctor in your specialty. But if it's not in your specialty, like why are they here? what have they been dealing with? Like, what is their history? Why are they going to the doctor, right? Um, and then, so you just kind of read the most recent note, at least, and try and just figure out, before you even talk to them, if you can, their story. Why are they in the hospital? Why are they coming? Because the most important thing, right? Like, when you go do like a standardized patient, right? You just walk in and start talking to the patient. You get the whole story out of their mouth, right? A couple problems with doing that on rotation. One, you don't have time. If you're in there talking to the patient for like a half hour, because they're not a standardized patient, they're going to talk longer than the actors will. If you're in there talking to them for a half hour or 45 minutes, like, your attending is going to come in and interrupt you and like not let you finish, right? Like, you don't have time to do that usually. And then two, if you do have time to do that, you go and you get the whole story, right? Like, you ask all these standardized questions, you do all this stuff. Like, you might miss really important things that your attending wants to know about, right? Like, say that you're in a primary care clinic, right? And today the patient is coming because recently they've had like some shortness of breath. And so you ask them all these questions about their shortness of breath. Then you go present to your attending and you like have like a differential, like, I think maybe, they're having some, COPD or whatever, right? Like, you go present all that, and then your attending is okay, well, how's their thyroid function? And you're like, what are you talking about? Like, I have no idea how their thyroid function is. Why would I ask that? Turns out they were here last week and they got an update on their thyroid medications, right? Like, your attending wants to know that kind of stuff, right? So when you look in the chart, see if there's any recent changes to their medications or any recent like specialist appointments or anything, like any recent changes to their healthcare, because this is an ongoing story that you're just jumping into the middle of. And so you want to have some background for kind of what is going on, right? When it's a cheat code, right? You read about that, and then when you go into the room, like, what you should be asking about, what you should know about. And then it's like a really easy way to just do these visits really quick. You just walk in, you're like, hey, I'm the medical student. Like, I saw you were here a couple weeks ago. Your doctor did this for you. Like, how is that going? Any changes with that? Get the update. And then you're like, okay, great. Is there anything else that you're here for today, right? Like, and then you kind of build this problem list immediately of like, hey, this is going on with this thing. This is a new thing that they need help with. This is a thing that they are complaining about, but I've read that they've complained to you about that a lot before, and that like they're not really doing what you've recommended. I don't really know. Anyway, so you just kind of come up with this quick list that when you're presenting to your attending, you can just rattle off real quick, and then they have action items when they walk in the room of what they can do. So you do that and you make their life easier, right? Like, they don't have to parse through all of that as much as because you did it, right? And that's how you can, make a good impression. Like, being a medical student in the clinic is inherently just annoying for everybody, right? Like, you are in the way. Nobody really likes you at baseline. Like, you're just making everybody's life harder, but you're there because your doctor feels strongly that it's important to teach the next generation of doctors, and that is a fantastic thing for them to do. Wonderful. So you want to do whatever you can to like help things move along, right? Like, help the clinic be more smooth, make it so that you're not like a burden on everybody, right? Like, if you are just, anyways, the other thing, this goes back to the attitude about the clinic in the first place, right? Like, don't interrupt your physician when they're talking to the patient to ask a question, right? Like, if you have a question about why your doctor is like prescribing a certain medication, just wait until after the visit and ask them in private, right? Like, when you ask a physician why they're doing something in front of a patient, like, that's like challenging them, and then you're going to make the patient question things, and then you're going to make the visit take longer, and it's just like, nobody has time for that. So just questions, asking good questions in the clinic is a really important skill, and the most important thing for that is reading, right? Like, before you ask any question to your attending, you should try and figure it out yourself, right? Like, if you think your patient has COPD and you tell your attending and they go in and it seems like they agree with you, they tell the patient that they think they have COPD, and then they prescribe a medication that you've never heard of before, like, don't ask them what that medication is, right? Like, Google it first. And you Google it, and then you're like, oh, that's a brand name for this other medication that I do know, but based off my reading, I thought you would have prescribed this other medication. And then instead of asking, hey, doctor, what is this medication?
and just looking like you don't know how to read, right? You ask, hey, so I noticed that you prescribed them this. I would have thought that the first line treatment for new onset COPD would have been this. Why did you do that instead? And then that is a good question, right? That is a question that shows that you're reading, you know what should be done. Like, you are trying to appreciate the nuances of clinical practice and the art of medicine. And those are the kind of questions that instantly make your attending think that you know what you're doing and trust you with more things just right off the get-go. The types of questions you ask, I think, play a huge role in the trust that you garner with your attending. So that's really important. I'm now seeing that I've been talking about this for 15 minutes. Sorry, this is, I think, a nuanced thing of how to do this, but I just want to let y'all know, like, you're gonna be fine. Read about stuff, be an independent learner, be in charge of your own learning, and it's gonna be a good time. Like, you're gonna learn a lot, you're gonna grow a lot. If you have any questions about specifics or anything in particular you're worried about, like, don't hesitate to reach out to me or any other students you may know who have been through it. Like, don't get lost. It's really easy to be lonely on rotations. Reach out to your friends, like, connect with each other. See a therapist, right? Like, you're gonna see some stuff that is not super fun, right? So make sure that you're talking to people and don't get lost just being alone. So anyways, I care about all of you. I hope that you're doing well, and yeah, good luck. It's gonna be great.